What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, flu test, maybe it was for RSV or some other virus, I hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, January 23rd, 2025. If you're new to my channel, welcome to my channel. You have found the channel that gives you updates on all the viruses that are making people sick. There's a lot of viruses out there. The viruses have been in high circulation this winter, and that continues to be the case up to today. And we have new viruses that we are keeping an eye on. Well, not so much new, but viruses that are constantly changing, such as bird flu. You're going to hear a little bit about that in just a little bit, so stick around. If you're new here, subscribe down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and leave your comments down below. Let's try for 200 like button hits again today. And by the end of the year, my goal is 10,000 subscribers. Let's see if we can do that. Alrighty, we do have a ton of news stories today. Matter of fact, it may be one of our busiest news day ever that we have had here on the channel. And then we do have a lot of data to go through as well. I think it's safe to say this video today will likely go over 20 minutes. I don't see how it's not going to go over 20 minutes. Alrighty, starting off with this. First suspected case of bird flu in Philadelphia has been detected in a snow goose. So this is not a good thing. It looks like it has happened in the West Philadelphia section of the city. Not good to see bird flu popping up in my own city. Taking a look at this. Just up to the north, up on Long Island, bird flu detected at Holflux, oldest and last large commercial duck farm. Yes, it sounds like a ton of birds have been exposed, and it says Holflux health officials say the farm houses more than 100,000 birds, and unfortunately all the birds are going to have to die because of this. So this is not good. Egg shortages are becoming a bigger deal. I'm seeing more and more posts on social media. I'm seeing bakeries saying they're having problems. Cost is rising. I'm seeing restaurants saying that they're having problems. Yes, this is getting really serious. And if you think everything I just told you is bad, it gets a whole lot worse. In Ohio, avian flu detected in 2 million birds in the Miami Valley. You heard me correctly. I said 2 million birds. The Ohio Department of Agriculture reported 2,052,773 birds have been depopulated in the Miami Valley because of H5N1 just since January 9th. Today is January 23rd. What is that? 14 days, if my math's correct? Yeah, that is not good. Drake and Mercer counties is where this is happening, and it does include turkeys and potentially others. So not only are we dealing with a shortage, heck, keep this up, turkeys. You know, Thanksgiving comes way later in the second half of the year. I wonder if there will be a turkey shortage this year. You know what? It's something to start thinking about. I mean, this is really impacting things. It's impacting cattle. It's impacting dairy. You're going to feel the prices at the grocery store. They're going to continue to be going up. And unfortunately, at any given time, we hope this doesn't happen. At any given time, the jump to human could happen. And we don't know. Could be now. Could be 5 minutes from now. I mean, could be 5 months. Could be several years. Could happen at any given time. All right, taking a look at this. Ohio Department of Health. We have a lot of things for Ohio today. Ohio Department of Health releases illness numbers and 2023 suicide report. Well, we'll talk about the illness numbers here, and they don't mention COVID. Surprise. Yeah, there's a lot of stories that don't. The only category to see an increase from week to week was in flu-related hospitalizations. In that single week, and this was leading up to week ending in January 11th, so this is a little behind. In that single week, 639 people in Ohio were admitted to the hospital, which was a 3.23% increase from the previous week. So that is a decent sized increase, and it signals that, hey, they have not peaked just yet, or at least not at that point. They may have peaked now, and we do know in Ohio, COVID at this point has peaked. I'll show you that a little bit later. All right, New York City sees 11% spike in reported flu cases. This is coming from the New York State Department of Health. And full disclosure with these articles, a lot of them are using data that is lagged. And to be fair, the data is lagged at this point. We're seeing drips and drabs of data, but still good to share these news stories to give you an idea of what has happened and what is happening during this winter virus season. New York. Flu cases continue to soar in New York. As reported, cases have risen by 6%, according to the New York State Department of Health. There were 32,218 reported cases statewide, including 15,675 in New York City. Every borough experienced a spike in cases except for Staten Island. Now, there's probably someone down below getting ready to leave a little comment that I would have to approve. Stating, well, there's millions of people in New York City, millions of people in New York. Aha, that you are correct. But here's the deal. When it comes to flu, prior to the COVID days, how many people actually went and got tested saying that they had flu and they just said, oh, it must be a really bad cold or something's really bad. Yeah, before the COVID era, getting tested for flu was not a big thing. And to this day, not everyone gets tested for flu. Heck, as we all know, there's a lot of people that will not bother to go out and get a COVID test. They just think, oh, it's just a sinus infection, this or that. So chances are this is a major undercount of what the real number is. From January 4th to 11th, Brooklyn experienced a 10% increase in reported cases, raising the total to 4,646. And we can see here, cases reported from January 4th to the 11th. The Bronx, 3,200 cases. Brooklyn, 4,600 cases. Manhattan, 2,400 cases. Queens, 4,500 cases. And Staten Island, 774 cases. Moving on now to this. Studies note higher risk of long COVID in women, differences among minority and kids. Get this. Yep. Study says there are higher risk, 31% higher risk in long COVID for women. We've seen this once or twice before, where a study or a report says that the risk is higher in women, and it is definitely something to be concerned about. I'll make sure this study makes it over onto the archives at my site, datareport.info. Alrighty, we do have some announcements today. School closings. Who remembers when you were a kid, you waited, and, well, I'm a kid from the 90s and 2000s anyhow. I remember when you would wait for the announcement during a snowstorm or something. Ooh, is school going to be closed? And they would make us wait till 5 a.m. the next morning. Well, guess what? Nowadays, we have new reasons for that to occur. One that I don't ever recall occurring when I went to school many, many years ago. And that was waiting to see if your school was closed because of illness. Yep, it's a thing. We got illness closures today, and we got quite a few of them. 2 Southeast Missouri school districts cancels for Thursday and Friday classes due to illness. Yep. A number of students and staff are out sick. We've been seeing these pop up quite a bit lately, and we got more. Weber Falls schools switch to distance learning amid illness outbreak. Not seeing where this is. Oklahoma. This is where this is. And we did see Oklahoma have another report recently. I do think we did include that, and I should give you a note. I have to add this in there. Long COVID. COVID itself. Oklahoma, when it comes to long COVID, I shouldn't say COVID itself, but COVID can cause immune system problems. Oklahoma has one of the highest rates of long COVID. Immune deficiency can happen with COVID. Could potentially be a reason why Oklahoma is getting hit so hard with these illness outbreaks. Just something to keep an eye on. Moving on to this one now. And hey, look, another Oklahoma. Fairland, Oklahoma. Fairland Public Schools has announced that classes will be canceled on Thursday, January 23rd, and Friday, January 24th, due to a significant increase in absentee caused by illness. Yep, a significant number of people being absent, and it says the number of illnesses is nearing 25% absentees. Wow, that's not good. And we do have yet another illness report. This time, I believe this is in Tennessee. The Milan Special School District closes due to widespread illness. So there you go. There's your school closings for today that are not due to anything weather-related, cold, anything like that. But, yep, illnesses. And, the majority of them aren't even saying what the illnesses are. It's probably flu, COVID, RSV. The one did mention strep. That's interesting to see that included into the mix. We haven't seen any strep stories lately, nor have I researched it much. Maybe I'll do a search and see if anything pops up. South suburban Chicago farm loses entire flock of hens due to bird flu outbreak. I should have put this in the beginning, and I forgot to do that. But yes, this is another bird flu story. I don't know. Did we share this the other day? I honestly don't remember. This is from the 22nd. No, says this story was posted last night. That was after we already did 10:30 at night. Yeah, we would never record an update that late. Nor do I think we ever have. We may have one time. I don't know. Sting is steadily improving after illness prevented him from singing. Will resume performances. So all of a sudden he is going to resume. Yeah. Get this. Sounds like he had something that caused him to have problems with his voice, which prevented him from singing. All right. Mission Health has temporarily restricted visitors amid rise in flu cases. This is in North Carolina. So yet again, another area which is dealing with problems when it comes to the viruses, and they're having to put restrictions at the hospitals. All right. Yesterday, there were a ton of sports-related illnesses when it comes to the NBA, the National Basketball Association. We're not going to list them all, but you get the point here. Just look at this. I actually just did a one-for-all post in my tracking thread yesterday. It is a real problem, and I wish we knew the real number of NBA players that are dealing with long COVID. It would be really interesting to know that, because it just seems like the NBA is getting hit very hard this year. I don't recall anything like this in the pre-times before COVID. I just really do not. Taking a look at the site, nothing really new to show you. I did add some more studies to the archive last night. My night owl session. What that means is I have trouble sleeping at night sometimes. So what I do is I just update the threads on my site, and then eventually I do get tired and go to sleep. All right, taking a look here in Canada, on the Canada page, COVID-19 viral activity level is moderate, flu A is high, flu B is moderate, and RSV is listed at high at this time. All right, it is Thursday, which means we should have gotten an update from the UK. COVID data did not really update. The flu data did. All right, take a look at this. Up to January 14th, it's January 23rd. All of these numbers are lagged. 805 cases, that's down by 10.9%. Weekly deaths, 126. I believe that's the same number from last week, so that didn't update. And the healthcare number is still from December 2024. That did not update. What did update in the UK? Well, good question. Here we go. Influenza did update, and it is continuing to drop. At this time, the positivity rate is still 14.8%. Got some work to do there. Got to get that below 10%. Air qualities. This is a real problem today, not just in the West Coast. The East Coast is bad as well. The thickest of the bad air qualities, though, is in the West Coast, and this is actually a significant improvement from this morning out on the West Coast, where we saw way more red sites. I think there were even some purple sites this morning, which is just really dangerous air qualities. Then you come to the east, from about Georgia, Alabama, on northward into the Mid-Atlantic, and even portions of the Northeast. Air quality is bad. It impacted me this morning. I haven't gone anywhere today because bad air quality days really upset my asthma, especially now that I've had COVID. I don't know what the new outcome, what the new normal is for me. I'm still trying to figure that out now that I've had, COVID back around the holidays, so I'll have to get that figured out. I'm just worried that the air quality is going to really get to me, because I remember the last time I had COVID afterwards, back in 2020. Things were really bad on bad air quality days, and I was quite congested this morning. Luckily, has gotten a little bit better now, and you're probably thinking, well, my voice sounds fine today. Sounds fine now. This morning, you would have heard a different outcome. All right, in Pinellas County, Florida. Taking a look here, and wow, I'm actually a little, wow. Not 1, not 2, not 3, not 4, not 5, not 6, not 7, not 8, but 9 sick person calls right now. That's really bad. And keep in mind, it is really cold, or has been really cold down in Florida. They even had winter weather in Florida. I don't think the snow made it as far south as Tampa, but You get the point. People are stuck inside. I said this could cause an increase in illnesses. And, well, just look at the number of sick person calls right now in Pinellas County, Florida. That's a red flag. That's something we will have to keep our eyes on. Philadelphia on Wednesday reported 734 EMS incidents at this time. Doing a live look in at Montgomery County, and I'm going to say this is good news. And you're probably going, well, that's a lot of calls. Okay, just before we did our update a little bit earlier, there was upwards of 25 active EMS calls in Montgomery County, Pennsylvania. That's a lot more than the 13 there is right now. So at least it's coming down. 13's still high, though. And we do see respiratory emergency listed multiple times. It also looks like there is a good number of calls in Chester County, Pennsylvania at this time. 1, 2, 3, 4, 5, 6, 7, 8, 9. About 10 calls at this time. So not terrible, but could be better. We would like to see things better. Hospital situation in Pennsylvania. There are some hospitals diverting. Not as many as there were earlier. There was one in rural Pennsylvania I saw divert, which is unusual to see that pop up on this map in rural central Pennsylvania. Also seeing southeast Pennsylvania is getting hit hard, but we must move on. New Jersey. Yeah, wait till I show you this. This is not good. There are several. Last count, there were 14. Let's see, how many are there now? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 hospitals right now dealing with some sort of an issue, and I'm seeing the words divert many times showing up here. 4 hours, 2 hours, surgical divert. Yeah, things are really busy in New Jersey. Matter of fact, this is back to where the peak was when it came to hospital issues just a few weeks ago. Not good to see it back to that once again. And New Jersey wastewater has not been straight down. Emergency department visits for COVID has not been straight down. There have been some ongoing issues in New Jersey. All right, taking a look at what's going on in Pennsylvania. And here's the COVID dashboard for Pennsylvania. How convenient. Some wastewater sites that were starting to rise again for COVID or did not peak are now grayed out. Pottstown, Pennsylvania, Norristown, Pennsylvania had a big increase. Well, guess what? Yeah, surprise, they did not report this week. Why is that? I mean, dude, are they trying to cover it up? I don't want to be a conspiracy theorist, but there are definitely some problems now. Lower Marion, Montgomery County is seeing a large increase at this time. There are some places that are showing decreases as well, but Lower Marion, large increase. That is part of, these are 15-day trends, and part of that trend comes from last week. Most recently, it is still not doing the large increase when I take a look at the chart. Alrighty, moving on now. Walgreens this week for flu, the positivity rate was 6.44%, and for COVID this week, Walgreens was 12.3%. Alright, I have to show this to you. This is subject to change. It's subject to update, but, you know, we don't have much CDC data anymore, so we may have to rely on wastewater scan a little bit more heavier than we used to. Take a look at this. You can see national COVID levels on January 6th peaked. Then they were dropping. Now all of a sudden we're seeing an increase again. Hopefully this will correct and drop, but there have been several states that have been reporting increases all of a sudden once again for COVID. So this is something we will obviously have to keep our eyes on. That the fact that it is rising, we'll see. We'll get another update tomorrow and then again next week. Hopefully it does not continue. Taking a look now, let's go to this. Houston, Texas. Let's take a look at what's going on. Now this is as of January 13th, and we can see here a lot of the wastewater sites in Houston, Texas for COVID. Now this is just COVID, is flat. And there are a few that are still rising. One here in the middle of town still rising, and on the west side. But everywhere else seems to be flat or even dropping at this time. The majority of them are just listed at flat. New York State, good news. Cases did not continue their rise today. 1,127 new cases reported. And cases in New York State today, hospitalizations in New York State today did report a drop. 885 with 83 people in the ICU. And the good news about that case drop is that also does include some New York City data. Remember, it is Thursday, and we do get our updates from New York City on Thursday. Alrighty, let's pause for a daily hydration break. Some days I forget to do this. I want to include this every day. Let's take a moment to just hydrate. It's very important to keep yourself hydrated. and especially because we're about to read a bunch of data here in just a moment. Moving on next now to what is going on in Colorado, and we do see in Colorado, things are dropping now for COVID. The positivity rate's 4.41%. The number of admissions is down. Influenza is dropping when it comes to hospital admissions. The positivity rate for influenza, get this, it's up again, 19.14%. Yeah, really bad. It's up by almost 0.7%. RSV is increasing. RSV hospital admission count is 176. The weekly positivity rate has increased by over almost 1.6%. It's up to 8.57%. So RSV still a problem in Colorado, and it says here SARS-CoV-2 is increasing in 13 out of the 20 monitored utilities. Influenza is detected in 19 out of 20 monitored utilities, and RSV is also detected in 19 out of 20 as well. In the state of Washington is seeing decreases at this time for COVID. It says here 10 people in the ICU for COVID, 34 in the ICU for influenza, and that actually is a increase by 6. So the ICU situation for influenza at this time is doing pretty bad. In Ohio, we have two things to take a look at. First, current influenza activity in Ohio is running high, and we should have expected that. David Christopher has said his hospital in Northeast Ohio is getting hit bad, and take a look at this. 145 hospitalizations just in Northeast Ohio alone. And we do see here the majority of things here are starting to drop, but hospitalizations are still trending upward. Taking a look at COVID in Ohio, and we do see the 3-week trend shows COVID continues to drop. 4,474 new cases added. 200 is the number of hospitalizations. Number of people in the ICU is now up to 11, and I should add, 200 is the number added to their total. We don't know what the current number of hospitalized patients is. We just know how many occur each week. And deaths, yeah, they're continuing to rise. Now up to 40 deaths this week from COVID in the state of Ohio. And remember, deaths are the last lagging indicator. We'll have to see if that continues to go up next week or if it starts to show signs of peaking. Alrighty, we do have some data from CJS 83172. And the data is as follows. Florida, daily number, 834 new cases. New Jersey, a weekday number, 907 new cases and 5 new deaths. New York, daily number, this was the number that New York reported yesterday, 925 new cases. Puerto Rico, daily number, 394 new cases and 1 new death. Arkansas, weekly number, 13 new state reported deaths, 14,159 total COVID deaths as reported by the state. Arizona, weekly number, 3,724 new cases reported over the past 2 weeks. Delaware, weekly number, 249 new cases and 1 new death. 3,798 total COVID deaths as reported by the state. Hawaii this week had 110 new COVID cases. Maryland, 1,202 new cases and 20 new deaths. Their total is 18,453 total COVID deaths. Maryland did see an increase this week. North Dakota, weekly, 351 new cases and 1 reported death by the CDC. Their total number of deaths is 2,798. Nevada, weekly number, 319 new cases and 2 new deaths. 12,675 total COVID deaths as reported by the state. Oregon, weekly number, 6 new state reported deaths, 10,721 total deaths as reported by the state. South Dakota, weekly number, 484 new cases, 2 new deaths, and 3,476 total COVID deaths from the start of the pandemic. Washington, weekly number, 256 emergency department visits, and 12 new COVID deaths. So that is not good to see all these deaths this week, and see that there are some places that are seeing rises once again for COVID. Again, do we know if that's explaining that rise in wastewater scan? No, we don't. We probably won't know till tomorrow or maybe next week to see if that is legitimate or if it corrects and just levels off or something else happens. Alrighty, folks, that does it for the Thursday edition of the Virus Update. I know it was a long update today, but there was a lot of stuff to get through today. If you enjoyed this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. And of course, if you want to support the channel and my work here that I do on my channel on the website, there are ways listed in the description down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching. Take care.